Cancer-related fatigue is reported more frequently than any other symptom of cancer. It affects between 70 to 80% of cancer survivors somewhere in the continuum of their care. When we address cancer-related fatigue, when we talk about how we functional scales, we talked about METs, we talked about ratings of perceived exertion, the Borg scale. We talked about relating those into the gas tank analogy. For example, when you're working with multiple myeloma patients, that is the number one complaint that they will have, fatigue and pain. And with a multiple myeloma patient, the restrictions that you have is multiple myeloma affects the bone marrow, and multiple myeloma affects almost all of your bones, particularly your axial skeleton, your femurs, your humerus, your ribs, your pelvis, your spine. And the amount of pain, they're on pain medications, which can further tire them out. But because their bones are so very weak, you cannot do any loading, any resistance exercise, any torsion, any twisting. And so developing a program for them dealing with cancer-related fatigue is tough. Yes, we can get them on what I do is I get them on an interval training. I get them on, we're going to start at the treadmill. And even if that's 3 to 5 minutes where we're starting, that's where we're going to start. We're going to see how long of a rest break they need, where they are, ask them about the gas tank analogy. Are you at a quarter tank? We don't want you to get below a quarter tank. What is your MET? What's that equivalent? The amount of energy it takes you to do that task. And then we're going to move on to the next piece of equipment, whether that be the recumbent bike, whether that be the elliptical. So we're going to take them through and gradually increase the amount of time that they're on these exercise equipment and decrease the amount of rest that they need over a period of time. And those are the main areas that you're focusing on in your treatment program.